Good afternoon. Welcome, everybody. Thank you for taking time out of your busy day. This is going to become an annual event, and having our very own Health Policy Center kind of introduce us to what's shaken at the legislature. So we have Dr. Lauren Hughes, who's a family physician in our department, and she's our state policy the Farley Health Policy Center, and state policy impacts us on a day-to-day basis quite a bit. Oh, there we go. All right. Back up. I'll just keep going. Hello, hello. Okay, there we go. And she also serves as the chair of the Rural Health Redesign Center Organization Board of Directors, and a director for the American Medical Student Association Foundation. And one thing we're extremely proud of, Lauren is one of 2 co-chairs for the National Academies of Science, Engineering, and Medicine Standing Primary Care, which is really overseeing federal government's efforts to strengthen primary care. She leads everyday initiatives and keeps her eye on the ball of policy. And if you talk to Lauren for more than about 2 minutes, she can find some connection to policy for almost any topic you can bring up. And she's a dedicated world traveler, just back from Copenhagen and France. And she has a particular passion for rural health services delivery and integrated behavioral health and primary care. And our second speaker, who is not here in person because he has a bad cold, and we appreciate him not bringing his infection here, is our own Dr. Kyle Leggott. He's a family doc, assistant professor of family medicine, and he's also a health policy scholar as part of his junior faculty fellowship, Health Policy Center. He's a board member, really one of the founding, he's been a board member of the American Academy of Colorado Academy of Family Physicians. And he's been somebody that's working for a long time in GME funding reform. So he, along with other members of our department, are founding members of the GME Initiative, which is a nonprofit organization founded to reform how we finance residency education. He's really interested in policy development translation, intersection of policy with state-based health legislation. And one thing about Kyle, he's also very interested in politics. He can talk policy, but politics is whether it actually comes into being or not. And Kyle's very interested in that. He wants a progressive and innovative solutions to address these health inequities. And really, how do we get system-based policy changes and policy level interventions? So thank you both for coming to prepare us for the legislative session.
Great. Thank you so much, Myra, for the kind of introduction. And just a sound check. Can everyone in the room hear me okay? Awesome. Okay. If something happens in the back, Dan, I'm looking at you. You can let me know if something happens with the sound. So Kyle and I are pleased to share this presentation with you today and kind of kick off the year's DFM monthly meetings. We'll be providing an introduction to the 25 General Assembly session that convened its first day today. So fun to have this presentation coincide with that. So what are we going to be talking about today? I'm going to be speaking to why engaging in the legislative process matters. We'll provide an overview of the legislative process and the budget process, which is a very important way to advance policy initiatives that often isn't always top of mind. And then Kyle, I'll turn over to Kyle, and he will do a look back at 2024, a look ahead to 2025. And then in the end, we will give a shameless plug and talk about our monthly legislative updates that will get underway on January 27th of this month. So as we proceed through the conversation today, I invite you to reflect upon how the legislative and budget processes impact how we practice, what we research and teach, and what services and resources our patients have access to. So as a reminder, the Farley Health Policy Center, we are an interprofessional team of policy experts, educators, and learners based here on the Anschutz campus. If you have not had a chance to visit our offices, we're on the fourth floor of the Health Sciences building. We love visitors, so please come on over. But more importantly, if you have a clinical question or project, or you have a research question or project, or a community question or project for which there may be a policy bent, or you'd like to talk about the policy implications of that work, please reach out. Those are the kinds of conversations that we love to have and help you think through the policy impacts of the work that you are doing. Well, speaking of policy, advocacy, and lobbying, just a level set from the get-go. I often find in my work in this space that sometimes these terms, particularly policy and advocacy, not so much lobbying, but tend to get conflated or confused with one another. These are kind of the working definitions that we use in the Farley Center. In terms of policy, we think of it as the work of articulating problems and analyzing, designing, and researching potential solutions with the goal of informing a course of action. Now, that course of action can be pursued by government, of course, at the local, state, and federal levels, but also could be pursued by a business or another group. When you move into the advocacy space, you're kind of moving into a series of activities that are intended to educate decision makers and to influence their decisions regarding a particular cause or policy. And then if you are registered as a lobbyist, which I am not, I never have been, I don't think I have ever any interest of being one. Kyle also is not. At present anyway. But lobbying is a set of activities that are designed to attempt to influence specific pieces of legislation, either in support or in opposition. Throughout our presentation today will largely be coming from the policy and sometimes the advocacy perspectives. So policy and advocacy can take place at many levels, from the individual clinic level all the way through the international level. When I'm in clinic seeing patients and I'm maybe engaged in some, sometimes some challenging prior authorization situations, or helping a patient navigate his or her insurance or lack thereof, in many ways I am engaging sometimes in policy and advocacy on behalf of that patient and family to help connect them to what it is that they need. I know there's so much valuable work happening in the department to make policy change happen at the hospital or health system, the community levels. The Farley Center, we have a primary lens on state-based policy work here in Colorado, but in other states as well. So we tend to dwell in that dark blue concentric circle, but some of the work we do also impacts national level, federal level policy, as well as down to the community and hospital and health system. So important to think about policy and advocacy across a different scale, from the clinic to the international level, and also in scope. How narrow or broad is the policy that you are working on? So policy and advocacy collectively are a set of tools to make your research and experience actionable, which can include informing the legislative process. And that is what primarily we're here to talk about today. So why does all of this matter? I personally contend that what happens in our own lives, what happens in our own state impacts our personal and professional lives, often to a greater extent than what happens at the federal level. Of course, that all depends on what is the issue that we're talking about. But as such, it behooves us to pay attention and get involved so that we can shape and inform policy outcomes. I hope you will find this work as fun and as interesting as we do in the Farley Center. But the most important take-home point, if anything else, from our conversation today is that please know that your expertise and your experience in research, in the community, in frontline clinical practice are incredibly valued and needed, and perhaps more than you realize as part of this legislative process. So what are some opportunities to get engaged? This is not an exhaustive list, but just a few thoughts to get the conversation started. sharing your experience as a clinician, if you are one, within the department, translating research findings and program experience to inform policy change, applying for funding made available through new legislation, helping to implement policy initiatives or evaluating the impact of new programs, and lastly, supporting the regulatory process or development of amendments to existing law if such changes are needed. I'd like to highlight a couple of examples that of recent state level policy work that highlight how engaged and informative individuals in or programs within the Department of Family Medicine have been. And certainly the expert on this program is not me, but Dr. Deutschman, who is here in the room. And so he certainly can add more details to this. But with the Colorado Rural Healthcare Workforce Initiative, what I find really important with this particular piece of legislation that was passed a couple of years ago is that it was really modeled after the School of Medicine's rural program. The goal of Senate Bill 22-172 was to address the shortage of healthcare workers in rural and frontier areas across this state. So this bill provided for the creation of new rural tracks within Colorado's public institutions. Implementation has been underway since July of 22. And when implementation gets underway, it's an opportunity to learn, oh, we actually could make some changes here to make this stronger in terms of the number of tracks or who needs to be involved or included in that educational training. A second example of some recent state legislation that engages members of the Department of Family Medicine is House Bill 19-1233, so passed now almost, I guess, 6 years ago. The goal of this particular piece of legislation is to reform payment to reduce healthcare costs by increasing primary care utilization. This piece of legislation did two things. The first was to establish the Primary Care Payment Reform Collaborative, which has been convening since July of 2019 to develop recommendations aimed at increasing investment in high-quality primary care. Dr. Stephanie Gold, one of the faculty in the Department of Family Medicine, was one of the founding members of this particular collaborative, and I have the pleasure of presently serving on this collaborative. And we are engaged in a lot of editing and back and forth negotiations over the recommendations to include in the 6th annual report, which will be released next month. This House bill also requires the Department of Insurance, or the Division of Insurance, excuse me, to establish premium affordability standards. One of the things I want to highlight with this particular collaborative is that it is set to sunset this September 1st. There is an agency within the Department of Regulatory Affairs. It's called COPR. That's one of my favorite state government acronyms. That stands for the Colorado Office of Policy, Research, and Regulatory Reform. Conducted a review last year about this collaborative, its impact, met with a number of stakeholders, and their ultimate recommendation was to renew essentially this collaborative and to keep it going in the future. That all depends what happens this legislative session, whether they will take up that recommendation, but COPR did make the recommendation to continue this collaborative. So a couple of recent examples of state legislation that has involved or impacted this department. So getting involved in the legislative process, I think about this in two buckets: as a private individual and as a public employee. As a private individual, learning how the process works, staying informed, sending emails or calling your legislator are some examples along with others that you see here. As a public employee, which we are as affiliates of this institution, important to use your personal email for communications about specific pieces of legislation, or if you have a personal interest in advocating for specific bills. Important to remember which hat you're wearing in different settings. So be clear on when or if you represent yourself or your organization as a private individual. And last but not least, it may seem like a small point, But if you are, for example, testifying on a specific bill, as a public employee, please don't wear any CU branded fleeces or your white coat with CU on it, et cetera. That can, can be a challenge. So make sure you're wearing non-branded clothing in that particular context. So an overview of the legislative process. This is a slide that I like to joke breaks all PowerPoint rules, right? Probably nothing you can read. It's too small, many graphics, et cetera. But this is still one of the best graphics that I have found that describes the very intricate, technical, procedural game in many ways that is how a bill becomes a law in Colorado. I will not go into all of the technical nuances and procedural details today, but I will in a few slides give you a website that if you really want to get into that, this is the website to go to learn all of that information. But at a high level, this is what it looks like for a bill to become a law. At its core, a bill is introduced, it's heard in committee, passes a chamber, goes to the other chamber, is heard in committee, passes that chamber, goes to the governor and passes and becomes law unless it is vetoed for whatever reason. There are so many nuanced steps. And remember that there are only 120 days by the Colorado Constitution for the General Assembly session. Today is the first day, and Sine Die, the last day of the session, is scheduled for May 7th of this year. And on another slide coming up, I have the number of bills that were introduced last year, and it's over 700. So thinking about the sheer number of bills that are getting somewhere along this pathway with all those different steps, it's pretty impressive. So the 2025 session, by a few key numbers, 120, the maximum number of days for this General Assembly session. We're in the 75th General Assembly. 100, there are 100 citizens that are either elected or selected to serve their peers. In Colorado, that's 65 representatives and 35 senators. The Democrats hold a majority in both the House and the Senate this year. We are very close to a supermajority, but just fell short by 1 or 2 seats in both chambers. So the Democrats in the House, it is 43-22, and in the Senate, it is 23-12. 2027. This is the sort of the realistic next anticipated opportunity from a political perspective for Republicans to take state control. And I say that because the 4 major state level offices, governor, attorney general, secretary of state, and treasurer are currently held by Democrats. 52 is a fun new number this year, which represents the number of women. So over 50% of the legislature this year are seats held by women. 22, the number of freshman representatives in the House. So this is a third of our representatives are brand spanking new. They have been through a fire hose the last few days of orientation. Today is their first day. Number 3, we had 3 senators that resigned after they won election on November 5th. This includes Democratic State Senators Chris Hansen and Janet Buckner, along with Republican State Senator Kevin Van Winkle. And all 3 seats have been filled through the vacancy committee process. And then 750 million and 350 million. Those numbers will come into play when I talk a little bit about the budget process. But 750 million is the estimated state budget shortfall this year that we have to figure out how to address the next few months. The 350 million is the new law enforcement spending that voters passed through Proposition 130. That also has to be funded. Proposition 130 does not allow new taxes to be levied to pay for that. So that means that additional state cuts have to be made to pay for that proposition passed by voters. Despite majorities, Democrats face challenges. And some of these challenges are ones that tend to come up, every year. Like implementation takes time for new initiatives. Keeping a legislative calendar running smoothly is hard work. And the last one I want to highlight on this slide is related to the recent resignations of 3 state senators after the election. It is shining new light or renewed light in many ways on the vacancy committee process, because that vacancy committee process selects individuals to take those seats. Those are not individuals, they're individuals that are serving in the legislature, but they are not ones that the general population within that district has had a chance to vote on. So we may see some movement or attention on that vacancy committee process. For the sake of time, I will bypass this slide. We'll make these available for you afterward. I will highlight that the PDF link at the bottom has many, many, many more important dates that sort of guide the procedural work, the business work of a General Assembly. And again, 2 important dates, today being the first, we convene today, and the 100-day race is on to May 7th. A number of bills are introduced each year, and you can see that the top row of numbers and the kind of the lighter shaded boxes are the number of bills that are introduced every year, and then the pass rate. I would like to highlight that last year, 705 bills were introduced. That's a lot. It's a lot of bills. And the pass rate was 74%. I want to talk briefly about committees. Committees are an important part of the legislative process and how work gets done. These are referred to as committees of reference. House committees of reference meet primarily during the legislative session to consider legislation and provide oversight of executive branch agencies. And you see the names of the different committees of reference here. Pertinent to our work, I will just highlight the purpose of the Health and Human Services Committee of Reference. This committee considers matters concerning state health and welfare programs, health insurance, social services, and environmental health. Similarly, the Senate has its committees of reference that you see listed here. And the purpose of the Health and Human Services Committee in the Senate is roughly akin to what it is in the House. We also have year-round committees that, as sort of implied in the title, are committees that meet not just during session, but also in the interim between sessions. There are a lot of committees that we need to have be on a year-round basis to continue important work of state government between General Assembly sessions. And one I'd like to highlight here, because it'll be very important as a setup for talking about the budget process, is the Joint Budget Committee. This is the state's permanent fiscal and budget review agency. It's charged with studying the management, operations, programs, and fiscal needs of the agencies and institutions of Colorado state government. So the JBC, as it's called for short, very active throughout the year, hosting a number of meetings and hearings and considering a range of documents to help prepare the General Assembly for it's a very important task, one of many, of debating and passing a budget for the coming fiscal year. These are the 6 individuals that are on the Joint Budget Committee, and they're balanced by Senate and House representation. They're balanced by political, representation. But just want to acknowledge that, all the committees work incredibly hard. That's not the issue. But the Joint Budget Committee in particular works incredibly hard, and they will be in overdrive this year, given the state budget shortfall that we are looking at. There are also interim committees that meet as you might expect in the interim between General Assembly sessions to consider issues of importance to the state. And so these are just some examples of what some of those are. This is that website I was referring to earlier, that if you want to get really into the weeds of procedural details of how the legislative process works, this is the website to go to, the Office of Legislative and Legal Services. So a couple more slides before I turn it over to Kyle. I'd like to briefly introduce the budget process in the state. On January 27th, when we have our first legislative monthly update, we will devote a portion of that time to going into more depth on different aspects of the budget. So I wanted to tee it up here for that later conversation. I think about the budget process in three buckets. There's what the governor prepares for his budget. There is the work of the legislature, and then there's the final budget that we get to through the long bill process. So briefly on the governor's budget, during the late summer and early fall, executive branch departments submit their requests to the governor's office. The governor and his team review those requests. They think about that, kind of filter that through the priorities of the governor. They also make assumptions based on what will the judicial branch submit? What will the legislative branch submit to keep those branches moving? Because you have to be mindful of keeping an overall balanced budget. The governor's budget and the budgets from the judicial branch are due to the Joint Budget Committee on November 1st. So that's always an important date every year. As soon as is practical, after November 1st, the Joint Budget Committee starts holding hearings with different analysts and with departments. These hearings are open to the public, but no public testimony is received at those different hearings. By February, by March, in that time frame, the Joint Budget Committee makes its final funding decisions for the upcoming fiscal year and prepares documents for the General Assembly detailing their decisions, their justifications, and for their different recommendations. The General Assembly, so this middle column here, they have access to the materials shared with them from the Joint Budget Committee. They also get information from the Capital Development Committee. So if you think about the capital needs for state government, buildings and processes, they get information from them, as well as from the Joint Technology Committee, in addition to economic forecasts that are about the Colorado and US economies. So they get a lot of information to help them tease out what will be the final budget. Those recommendations from the Joint Budget Committee are incorporated into what is called the long bill. And that narrative has lots and lots and lots of detail for all of their recommendations. That gets introduced to the full assembly either in late March or early April. It then weaves its way through both chambers and ultimately lands on the governor's desk to sign or line item veto different parts of the budget. Briefly, TABOR, the Taxpayers Bill of Rights, was a 92 constitutional amendment here in this state. TABOR is often a challenge in a number of ways when it comes to revenue generation, taxes, for example, and then how we are able to spend money. The heart of TABOR is that the state can retain and spend a certain amount based on the prior fiscal year's actual revenue or limit, whichever is lower. There is a calculation that respects inflation and population growth. And in essence, voters have to approve any tax increases and must give permission to the state to spend money collected under the existing tax rate if revenues grow faster than the rate of inflation and population growth. So TABOR it can be challenging in terms of leading to restrictive limits on spending. And it means that it's hard for Colorado sometimes to make long-term investments. So briefly, Governor Polis's key budget priorities for the next fiscal year. They are these 6 that you see here. For the governor, he's expressed it's important to make Colorado one of the top 10 safest states to invest in education, save families money, advance physical and behavioral health, and drive more government efficiency, and also to make strategic balancing proposals, his words, while maintaining reserves to try to close that budget gap. So how did he propose to close a $1 billion plus budget gap? A number of different ways. I'll highlight a couple of these. They'll be pertinent to the department. He's proposed to freeze reimbursement rates for most Medicaid providers. Important to know that every 1% rate increase for Medicaid costs the state $40 million. So that is one of the pieces that he has kept in mind to try to close this gap. Also changes to education and to privatizing state workers' compensation insurer. And so other proposals here, we'll see how this all shapes up. So last slide for my portion, why are we facing a budget crunch? It's a confluence of a number of different factors. Lawmakers have made decisions to cut school and local government property taxes 3 times in the past year, which indirectly impacts the state budget because increases the state's required contributions for K-12 funding. Medicaid grew faster than state officials expected. So that comes with a big price tag. Medicaid, as we move forward, will also be expected to have higher costs because of a growing population of elderly and disabled Coloradans that are covered through that program. Inflation has fallen, and in that Tabor calculation impacts how much the general fund can increase under that particular piece of legislation. And then pandemic-related federal dollars, many of which are coming into the state, that's now done. So several factors that are leading us to where we are. And with that, I'll turn it over to Kyle. We're just going to make a quick switch.
Excellent. Thank you, Lauren, and I hope everyone can hear me. Sorry that I cannot be there in person for you all, but I figure better for me not to be causing you all to be sick. So before we dive into what's on the docket for 2025, today being the first day of the legislative session, we're actually going to look back at 2024. And the reason is a lot of the things that we're going to see here in 2025 are actually going to be implementation of bills that passed in 2024. So although we're in the 2025 legislative session, I always remind people it's really important to keep an eye on bills and important pieces of legislation that passed in years prior, because the implementation oftentimes takes multiple years, and that's a time for us to engage in that process as well. So really quickly, just to highlight a few other pieces, the 2024 legislative session, 705 bills introduced. That's the highest number since 2018. Of those 705, 525 passed. Most, but not all, had bipartisan support. So 325 had bipartisan support. That means that 200 had solely Democratic support, because not a single bill that passed was solely sponsored by Republicans, just kind of cementing that last year there was a supermajority in the House and a near supermajority in the Senate, and there really will not be any solely sponsored Republican bills that pass in this legislative session as well. 180 bills failed. Most of those failed in committee or were postponed indefinitely. That's the language that is used. But 75 failed in other ways. And actually quite a few of those failed because of how chaotic the end of the session is. And this is true most years, but last year I'll just highlight there were 308. So almost half of the bills that were introduced still didn't have a decision within a week of the end of the legislative session, or within 6 days. There were 236 bills that needed some form of action in the last 48 hours. And one of the biggest bills of the entire session, property tax relief, only came in within the last 2 days. So just to highlight for those who follow the legislative sessions, there's an ebb and a flow to the chaos and the pace of the legislative sessions. January is slow. It is a lot of committee meetings. Bills begin to be introduced towards the end of January. February, things pick up. March and April, there's a pretty steady beat of committee hearings, bills being passed and heard and negotiated. And then May is all chaos, and is nothing but chaos for the last couple of weeks of session. Next slide. Also, we had ballot measures. So if we look back, hopefully everyone here had the opportunity to fill in their ballot measures. So I'm just going to recap a couple of the results from the 2024 ballot measures that I think are relevant to us or that you may be interested in. Number one, you'll see that ballot measures are broken into propositions and amendments. Amendments are amendments to the Colorado Constitution. Those are a higher level of kind of investment for voters and require 55% in order to pass. So here in Colorado, here's 4 of the amendments. One of them expanded veteran property tax exemptions. Another repealed our ban on same-sex marriage because even now in 2024, Colorado still had a provision in our state constitution that says only a union of one man and one woman shall be valid or recognized as marriage in the state. So the state repealed that. There was a very, very close vote on creating a constitutional right to school choice that did not pass. And then lastly, Amendment 79 passed 62% in favor, 38% opposed to create a constitutional right to abortion, and very importantly, repealed the prohibition of using state funds for abortion. That being said, there's currently, at least my understanding, not a effort or push to use Medicaid funding for abortions. Next slide. Couple of proposition measures here. So there was a measure around ranked choice voting in general elections that did not pass. The Proposition 129, I put in there just because I think it fits with other things that we've seen in Colorado in the medical field, although this is for veterinary medicine, the creation of a new category of vet professional workers called veterinary professional associates did pass at 52%. There was a 6.5% sales tax on firearms and ammunition that passed. So that levy 6.5% tax is going into something called the Firearms and Ammunitions Excise Tax Cash Fund, but essentially a separate pool of money that the state is going to use to fund crime victim program services, mental and behavioral health programs for children's vets and others who have been the victims of gun violence. And then Proposition 128 passed as well, lengthening prison time before parole eligibility. Next slide. So as a reminder, the areas that we focus in on bills, we bucket in these categories: healthcare access and costs, reproductive health, opioid substance use disorder, gun violence prevention, and social drivers and health equity. The following slides are really a resource for you all. We are not going to go through every single bill that we covered in our 2024 legislative session, but really this is designed to just show you all that we are covering a lot of bills in our monthly updates. I hope you can join us for those, and we will dive deeper into 2025 bills. You can just see a list here of lots of the bills. I will call out a couple as we go through. So we'll pause here on opioids and substance use disorder bills. Just calling out that the Overdose Prevention Center bill is the only one of these that did not pass and is expected to potentially come back. This would authorize a municipality or a local government to allow for the operation of a overdose prevention center within its jurisdiction. This bill has come forward multiple years in a row, has not had universal support from Democrats, generally opposed by Republicans and by the governor, but has kept coming back and has actually made it further and further each time. So I expect to see it again. Next slide. A lot of mental and behavioral health bills, especially around youth and social media last year, given the things happening in Australia and elsewhere in the world. I expect we're going to continue to see limits on social media for youth and children as we move into 2025. Next slide. Let's go to next slide. All right, couple of bills just to highlight here that happened in 2024 around social drivers and health equity. There was a bill on Medicaid coverage for housing and nutritional services. So HCPF, our Department of Healthcare Policy and Finance that runs Medicaid, is working with the federal government to get approval to cover health-related social needs that include things like housing and nutrition services, so that Medicaid providers and their associated clinics or systems can get reimbursed for those services and offering them. Next slide. Healthcare access and costs, there was a lot there. A lot happened. I know one thing that many in our department were really excited about or had strong opinions about was the Diabetes Prevention and Obesity Treatment Act. So this bill, you'll see third down on this slide, would have had our state seek approval to have all FDA-approved therapies for obesity and prediabetes through CMS. So we would have added all of the new GLP-1s and all of those different FDA-approved treatments to our Medicaid formulary and also would have required all state regulated health insurance plans to cover those as well. This bill was thought to potentially cost the state hundreds of millions of dollars in the short term, as a lot of those medications, especially the GLP-1 injectables, are fairly expensive. But proponents, would argue that the long-term benefits would have outweighed the short-term costs. Unfortunately, or however you think about it, it was laid over indefinitely in the House at the very end of the legislative session. And again, potentially one of those bills that got lost in the shuffle of 328 bills in the last 6 days that needed to get taken care of. Next slide. All right, and then a couple of bills that we covered and went over quite a bit last year as well. Non-economic damage caps to medical malpractice. There was a change to medical malpractice that we're happy to answer questions on, and I'm happy to provide resources for, but the limit for non-economic damages for medical malpractice did go up quite a bit. This bill in particular didn't pass, but others did. But you can see the Prevent Workplace Violence in Healthcare Settings, which was sponsored by the Colorado Hospital Association and a bunch of other kind of healthcare organizations, actually ended up getting laid over indefinitely in the House at the very end of session as well, on May 14th. Next slide. Let's go next slide. And we'll just keep going until we hit 2025. Yeah, there we go, looking ahead. So we're going to try to give you a sneak peek as to what's going on and going to happen in the next 120 days. It will not be a perfect crystal ball, but we'll do our best. Next slide. All right, so context that you've already heard, budget is king. That is huge. The budget shortfall is really most of what everyone's talking about, and how really the goal is to pass bills that aren't going to cost money, or at least aren't going to cost the state money. With that being said, there has at least been rumors of, should we tackle Tabor? Tabor seems to be one of the things that many people think limits us in our state budget. And so there are rumors that legislators may bring a legislative fix to Tabor, since we have not passed any ballot measures to adjust or fix Tabor in the recent past. There's a lot of conflicting proposals on where to cut, both from Governor Polis and from the JBC members and from other leaders within both the Republican and Democratic parties. And so we're going to see fights over the budget process. Affordable housing remains one of the top priorities, and I'll go through some proposed bills that are going to come forward around that. And then everyone is talking about acknowledging that there will likely be bills that are going to be introduced to directly respond to or combat new federal legislation or federal executive orders, given the big shift in Washington. And then, although there is a Democratic majority, it's no longer a super majority in the House, so that does change some of the power dynamics in terms of what can pass and what can't. Next slide. Just some headlines of what we're seeing in local newspapers around the legislative session. Next slide. So caveats for these next couple of slides. These are all bill ideas, concepts, and policy proposals. None of them are actual bills yet. The only bill that has really been introduced so far is to set a date for the State of the State, which is going to be tomorrow, where Governor Polis will address a joint meeting of both the House and the Senate. That's the only bill that's passed so far on day one. Many bills will undergo stakeholder engagement and change over time, so just be aware of that. Anything you see here is likely to change. Next slide. All right, so starting with union law, this is actually one of the potentially most controversial things, business fighting kind of worker protections and unions. There is a bill that is being dubbed the Worker Protection Act that is expected to be very controversial. Essentially, it would seek to eliminate the need for a second election for establishment of unions. So Colorado's Labor Peace Act requires 2 votes for essentially creation of a union structure that requires fees. That sets Colorado apart. I think we're the only state that has that, though at least a majority of states, it's a single vote. And so this would repeal that second vote that needs 75% to pass. And this is already, there's a lot of back and forth between business and workers and unions. Next slide. Worker protection. So kind of keeping with the theme, A couple of bills. One is going to be introduced around new protections for outdoor workers, especially in conditions of extreme weather. Most likely that's going to be cited heat, but there may be some cold as well, trying to protect people and put into place requirements for water breaks, shade, temperature maximums, minimums, etc. There is a bill that is coming forward to limit non-compete clauses specifically for physicians. So in Colorado, we currently have legislation that limits or restricts non-compete clauses in contracts for almost every type of employee. But in that legislation that came out a number of years ago, physicians were specifically carved out of those protections. And so there is a bill coming forward that would prohibit non-compete clauses in physician employment contracts and ensure that physicians have the ability to tell or inform their patients about new practice locations. That way you can preserve that continuity of care. So that is coming forward, and those are the current kind of main thrusts of that piece of legislation, though it may change or not pass, who knows? And then there is going to be an effort to address mental and behavioral health stigma in the medical licensure renewal process. So this is going to come either through a regulatory or legislative mechanism. That's not fully clear yet, but it may end up being a bill, which is why I put it here. Essentially, this would pursue language changes that limit the need to disclose behavioral or mental health diagnoses or current treatment on licensure renewal. So going to a therapist or being treated for major depressive disorder. And this would align with national best practices. Really, the national best practices around medical license renewal are that those types of questions should really only focus on current or active conditions that affect a physician's or a provider's ability to practice medical care safely. And so if it doesn't count for that, if you have depression that is well controlled, then you would not have to answer questions about your mental or behavioral health diagnoses. Next slide. Affordable housing, as I said, going to continue to be a large area of focus. There's going to be a bill that comes back to reduce the likelihood of lawsuits against people who build condominiums. That proposal came forward in 2024 and failed, but the new president of the Senate is the one who brought that bill in 2024, and he has said he wants to bring it in 2025. There's going to be efforts to increase modular housing, or essentially the building of multifamily housing units. There's going to be an effort to increase regulation of algorithms or rent setting algorithms. So oftentimes rent is set through an algorithm, and many people have brought up concerns that those algorithms may be unfair. There was an effort last year to actually ban all rent setting algorithms that failed. And so this is a more moderate or watered down version of that. And then there are going to be some efforts to lower construction costs for developers for sale affordable housing. So it's like Habitat for Humanity or others. And then you can see some of these other proposals as well. Next slide. Firearm injury prevention will continue to be a large area of focus for Colorado, has been for a number of years. These are three separate initiatives that have been quoted in newspaper articles from legislators who have said, we're going to bring these forward. The first is to raise the age to purchase firearm ammunition to 21. The current age to purchase handguns and rifles in Colorado is 21, but the age to purchase ammo is lower than that. So this would bring up that minimum age. There's a second proposal to require change requirements on how ammunition is sold, where it's stored in stores, and just kind of regulate ammunition a little bit more. And then thirdly, there's likely going to be a bill brought forward to put a ban on certain semi-automatic weapons. There was what was deemed an assault rifle ban that was proposed in 2024. So it may be similar or maybe a little bit different than that proposal. Next slide. All right, so that's the General Assembly website. There's a lot of great information on there. Learning to navigate it, I think, is a really powerful tool for those who are interested in these things. And as it says on there, this session convened today. Next slide. If you like this type of presentation, if you like staying up to date on what is going on down at our state capitol and really, keeping your finger on the pulse of state legislation, be it healthcare, related or more health, social driver equity related, Farley Center is very happy to help you do that. In order to do so, please join us at our monthly legislative updates. We are changing the time this year. It is going to be on the fourth Monday of each month, January through April, and then the third Monday in May. So 5 total legislative updates. So the first one is January 27th. You can email us, or we will make sure that we can send you out a link that you can sign up on. But it's a way to stay up to date on what's going on in the legislative session, since today is just the start. Next slide. All right, we'll skip past this, go to the end, and we are happy to answer questions in the last 6 minutes. Thanks, everyone.
We'll take questions in the room first. Just feel free to speak up because we're relying on the microphones that are overhead. And then if you have questions online, please feel free to submit them in the chat and I'll ask them for you in person.
So is it really just a simple math for Tabor that we gave back citizens of Colorado $1.5 billion last year, and the deficit this year is about the same? Is it, am I doing the math right, or is there something more complicated about the Tabor refunds?
Well, at a high level, yes, I think that, so that math would make sense. But this is one where there's, the devil is in the details. And so you have to break down the Tabor formula and look at how inflation and population growth is brought into that. So I think it's, our challenges from a budget perspective are, yes, inclusive or made more difficult by Tabor and some of those restrictions, but it's certainly very much multifactorial above and beyond that. But wouldn't it be nice if that math just worked out? Yes, Cleveland.
Any thoughts on facility fees will be coming back this year versus holding off on that for a bit?
Yeah. Kyle, did you hear that? It was the question of whether facility fees are likely to come back this year, or if that's going to be something that might be for the following year.
Yeah, great question. So facility fees were one of the most hotly contested healthcare related issues, not last year, but the year before. There is actually a report that was submitted to the General Assembly, I want to say early November, late October, which I will link in the chat, that goes through recommendations from a HCPUF-led task force on facility fees. I have not heard any rumblings that it will come forward, but I think something will, whether it's this legislative session or future. That report, I think, generates a lot of ideas on what to do and gives maybe a little bit of evidence that legislators were asking for when facility fees came up previously. The other thing that I will note is that actually just today, Gene Kuttner sent out an email about UC Health's community health needs assessment. So there was also, in the same year as the facility fees, a big push on the community benefit dollars. And one of the things that came out of that was some changes on the process for obtaining information about the community health needs assessment. So I encourage anyone to fill that survey out and just kind of watch and see what the community health needs assessment looks like, and to read it for your local hospital area as well, because they are required now by both federal and state legislation to gather that information and use it in slightly different ways.
Lots of gratitude being expressed online, but there's also an additional question. How do faculty get permission to testify as representatives of CU for specific bills? Who at CU needs to approve this?
Kyle, do you want to start with that one, given some of your experience in this area?
Yeah, so the short answer is government affairs. That's the best answer if you are interested in being an official representative for CU or your employer, for us is to go through government affairs. There are actually some carve-outs specifically for you being able to testify in your capacity as a researcher are a physician or your role without needing government affairs approval, but those are very specific and nuanced. And I would recommend that if you want to do that, to go through government affairs and ask them. Sometimes you'll be brought into those conversations. I know personally, I've been in on a few email chains where it's a list of different people, including government affairs or the dean or the dean's office, asking for your input as a faculty member on where should we come down on this specific piece of legislation. So even if you're not testifying, you can sometimes get your voice heard in that process.
Linda, go ahead.
So curious to get your ideas about this 350 million increase in law enforcement spending without an increase in taxes. I remember going through my ballot and reading that and thinking, I'm not sure most people are getting this. It seemed like something I'd never seen before, and it seemed very irresponsible. My response to it was, this is an irresponsible way to get something. People are always going to say yes to safety. And it's, I don't know, what are your thoughts there?
No, I think you're bringing up a good points around the intricacies of this process. And there's a lot of information that voters had to sort through this past election. There was a lot. And so lots of good resource to learn about that. But your point, which is, did voters appreciate that there wasn't going to be a new tax offset to pay for this proposal, may be something that, very well could have been gotten lost in the shuffle. So, but it just, maybe it'll be an important lesson moving forward that in this, process to pay attention to, ballot initiatives where there may be a similar sort of approach to getting something across the finish line again, and to be mindful of that and what kind of impacts that will have on, the following year's state budget process, because that is a price tag that we have to figure out where to cut otherwise to fulfill those obligations from the voters.
That's all the time that we have. I know that Lauren and Kyle remain available for additional questions. So thank you both so much for being here today. I do want to just make one additional note before everybody heads out. I already put it in the chat. Please make sure to take the surveys that are on the ends of the tables here. And then in addition, next week on Thursday, please look at your email inboxes. The DFM survey will be coming out. It's our semi-regular survey that goes out to the entire department. It will be anonymous in all of the information that is submitted back into the department, and you will be seeing follow-ups from me and from your ELT members, but please make sure to fill it out. It is very important to our policies and programs. So thank you again for being here today, and have a great day.